Hello, dear viewer. Today we'll talk about how to quickly lower blood pressure at home. Arterial hypertension is one of the most common health issues today. Many people experience sudden spikes in blood pressure, headache, dizziness, a throbbing sensation in the temples, or rapid heartbeat. This can happen at home, at work, or even in transport. At such moments, the most important thing is not to panic and to know simple and safe methods that really help bring the pressure down. The very first step is to calm down. When a person becomes anxious, stress hormones are released, which only make the situation worse. Sit comfortably, relax your shoulders, and take several deep breaths. There's a proven technique: inhale through the nose to the count of 4, hold your breath for 2 counts, and exhale slowly through the mouth to the count of 6. This rhythm helps reduce nervous system activity, normalize heart rate, and gradually stabilize blood pressure. It's also very important to ensure access to fresh air. Open a window, loosen tight clothing. This relieves the feeling of shortness of breath and makes it easier to cope. If possible, turn off loud noises and bright lights, since a calm environment by itself helps the body restore balance more quickly. Another simple method is warm foot baths. Heat causes blood vessels in the legs to expand, drawing some of the blood away from the head, which promotes lowering blood pressure. Keeping your feet in warm water for 10 to 15 minutes is usually enough. Don't forget about ordinary water. Drink a glass of clean, still water. Proper hydration makes the heart's work easier, reduces blood viscosity, and helps stabilize blood pressure naturally. Another method of quick relief is a cold compress on the back of the head. To do this, simply soak a towel in cold water or apply ice wrapped in fabric. The cold helps relieve blood vessel spasms in the brain, eases headaches, and contributes to blood pressure normalization. At the same time, it's helpful to gently massage the neck and shoulders. Muscle tension in this area often worsens the condition, while relaxation improves circulation and provides relief. Diaphragmatic breathing is also extremely effective. Lie on your back, place a hand on your stomach, and try to inhale so that your abdomen rises while your chest stays still. The exhale should be slow and deep. This type of breathing lowers heart rate, stabilizes the nervous system, and naturally lowers blood pressure. At home, you can also use herbal remedies. Tea with mint, lemon balm, or chamomile has a mild calming effect, reducing anxiety and inner tension. For some people, a small piece of dark chocolate with high cocoa content can also be helpful, since flavonoids promote blood vessel dilation. But here we're talking about a very moderate amount, just a few squares. Body position also plays an important role. If you're lying down, place a pillow under your head and shoulders so that your upper body is raised at a 30 to 45 degree angle. This reduces the strain on the heart and improves blood circulation. Of course, if you have medication prescribed by your doctor specifically to lower blood pressure, you should take it. But taking medicine not recommended by a specialist is strictly prohibited. Choosing the wrong drug can lead to dangerous consequences. After you've managed to bring your blood pressure down, it's important to consolidate the result and prevent another spike. To do this, avoid sudden movements, overexertion, or stressful situations immediately after your condition stabilizes. Your body needs time to recover. After a while, a slow walk in fresh air can be beneficial, since light physical activity helps regulate the heart and blood vessels. Diet also plays a key role. It's best to choose foods rich in potassium and magnesium, which support healthy cardiovascular function. These include bananas, legumes, spinach, beets, and pumpkin seeds. At the same time, salt intake should be reduced. Excess sodium causes fluid retention, raises blood pressure, and increases strain on the heart. If you've already experienced a sharp rise in blood pressure, try eating with minimal salt for at least a few days. Regular blood pressure monitoring is another important step. If you own a blood pressure monitor, check your pressure not only when you feel unwell but also during calm states, in the morning and evening. Keeping a record of your readings will help you see whether blood pressure spikes are random or part of a systematic problem that requires treatment. It's crucial to remember the warning signs. If your pressure rises above 180/110 mmHg and is accompanied by severe headache, chest pain, shortness of breath, blurred vision, or speech difficulties, this may indicate a hypertensive crisis. In such a case, you must call emergency services immediately. All the methods described here are only self-help techniques for mild or moderate increases in blood pressure. They do not replace proper treatment and prevention prescribed by a doctor. Your health is in your hands, take care of it, listen to your body's signals, and consult specialists in time.